Welcome back to Genes, Microbes, and AI, revolutionizing infection control and counseling. I'm your host Sakshi, and I'm so excited to dive into another episode where we explore how artificial intelligence is transforming the way we tackle infections and empower patients. Last time, we talked about how AI predicts outbreaks and how genetic counselors help people understand their risks. Catch that episode if you missed it. It's a game changer. Today, for episode 2, we are zooming in on a global health crisis fighting superbugs, AI, genomics, and counseling for resistant risk. We'll unpack how AI identifies resistance genes in pathogens, suggest new treatments, and work with genetic counseling to help patients understand their genetic predisposition to resistant infections and navigate their options. Joining me again is the brilliant Dr. Sukant Khurana, a neuroscientist and data science expert who's all about using AI to outsmart microbes. Dr. Khurana, thanks for being back.
My pleasure, Sakshi. Superbugs are tough opponent, but AI and counseling are powerful team. Let's get into it.
Oh, I'm ready. Let's start with the basics. Superbugs, those bacteria that shrug off antibiotics like they're nothing, are honestly terrifying. I have read about things like MRSA or drug resistant TB, and it feels overwhelming. Can you give us a quick picture of what makes antimicrobial resistance such a big deal and why it's so personal for patients?
Absolutely. Antimicrobial resistance or AMR is when bacteria or fungi evolve to resist drugs, turning routine infections like skin infections or pneumonia into serious threats. WHO says AMR could kill 10 million people by 2050 if we don't act. It's personal because anyone can get a resistant infection, especially in hospitals, and your genes can make you more vulnerable to severe outcomes. That's where AI and counseling step in.
10 million deaths. That hits hard. And the idea that my genes could make me more at risk. That's a lot to process. So let's talk about how AI is helping. You mentioned it can spot resistance genes in these superbugs. How does that work? And why is it such a big deal for fighting AMR?
AI is like genomic detective. It analyzes DNA of pathogens like Staphylococcus aureus or MRSA to find genes that cause disease, like MECA gene that blocks methicillin. Machine learning models trained on huge data sets of bacterial genomes scan for these genes or new mutations in hours, not weeks. This spread is critical and tells doctor which antibiotics won't work and suggests alternatives, saving precious time.
A genomic detective. That's so cool. I'm picturing AI zooming through DNA like it's solving a crime. But how does this connect to patients like me? Say, I'm in a hospital worried about a resistant infections. How does AI's work with resistance genes tie into genetic counseling to help me understand my risks?
Great question. AI doesn't just stop at the bug. It looks at your genes too. Some people have variants that weaken their immune responses, making resistant infections more dangerous. Genetic counselors take AI's findings, which superbugs are circulating, and your genetic profile, and explain what it means. They might say your genes suggest you are at higher risk for complications from MRSAs. Let's plan extra precautions. It's about giving you clarity and control.
Clarity and control. That's exactly what I would want in a scary situation like that. Can you share a real world example where AI and counseling have teamed up to tackle superbugs? I'd love to hear how does this actually plays out.
Sure. In 2024, a hospital in Canada used AI to tackle Pseudomonas aeruginosa, a superbug common in ICUs. The AI scanned patient samples, identified a resistance gene, and flagged an older drug combo that could work. Genetic counselors then stepped in, identifying patients with genetic markers for poor antibiotic metabolism. They worked with families to explain risks, tailor treatment plans with doctors, like adjusting doses or adding preventive measures. It cut severe infections by 25% in that unit.
A 25% drop. That's huge for patients and their loved ones. It really shows how AI and counseling together can make a difference. Let's talk about the treatment side. You said AI can suggest new strategies for superbugs. How does it come up with ideas for treatments when antibiotics are failing?
AI is super creative here. It cross-references a bug's resistance gene with drug databases to find workarounds, like using two drugs together to outsmart the bacteria. It can also design new molecules by predicting how they would attack a bug's weak points or weak spots. For example, in 2023, study used AI to propose peptide that killed resistant E. coli in drug tests. It's like AI drafting a playbook for doctors to beat superbugs.
A playbook. That's such a great way to think about it. I'm imagining doctors with this AI powered guide to outmaneuver bacteria. Now, let's bring counseling back in. If AI suggests a treatment, how does a genetic counselor help me navigate that? Like, what's the conversation like when I'm facing a resistant infection?
It's all about making it personal. A counselor might sit with you and say, Sakshi, he has found a resistant bug in your sample, but it suggests this drug combo could work. Your genes show you metabolize drugs slowly. So we'll adjust the dose. They would explain side effects, answer your questions, and even talk about lifestyle changes, like avoiding certain exposures to lower your risk. They are to make you feel supported, not just informed. Support is very crucial.
That support is everything. It's not just about the science, it's about the feeling heard and understood. I'm curious about the bigger picture. AMR is a global problem, right? How is AI and counseling helping reduce this burden worldwide, especially in places with fewer resources?
Globally, AI is a lifeline. It powers surveillance systems like the WHO's GLASS program by tracking resistance genes across countries. In low resource areas where sequencing is tough, AI uses what data is available to prioritize drugs or guide antibiotic stewardship. Counselors play a role too, educating communities about resistance risks and genetic factors even without fancy tech. It's slower in some places, but the impact is growing.
That's so important, making sure these tools reach everyone, not just high tech hospitals. What kind of AI tools are driving this fight against superbugs? Are we talking super advanced stuff?
It's a mix. Deep learning, like convolutional neural networks, is awesome for scanning genomic sequences, like reading DNA at lightning speed. Simpler models like gradient boosting predict resistance from clinical data like patient records. Natural language processing pulls insights from global health reports. Together, they give a full picture bugs, drugs, and risks.
A full picture, that's what we need. Okay, how close are we to seeing AI and genetic counseling as a standard part of fighting superbugs in healthcare? Is this already happening or are we still waiting?
It's happening, especially in places like US, Canada, and Europe, where hospitals use AI to guide antibiotic choices and counselors integrate genetic data. Globally, it's patchier. Data access and training are hurdles. But portable sequencing is closing the gap. In 3 to 5 years, I think most hospitals will pair AI with counseling for resistant infections, especially for high risk patients.
3 to 5 years, that's so close. What's the biggest challenge keeping us from getting there faster?
Data is the bottleneck. AI needs diverse, high quality genomic data, but many regions can't sequence regularly. Counselors also need training to interpret AI's outputs, turning stats into stories patients understand. And there's trust. Doctors and patients need to feel confident in AI suggestions. Plus, the superbugs keep evolving, so AI's got to stay sharp.
Those are real hurdles, but it sounds like we are on the right path. Let's end this with a vision for the future. If AI and genetic counseling keep advancing, what could the fight against superbugs look like in a decade?
Picture this: you go to a clinic, and a quick test sequences any infection you have. AI instantly flags resistance genes and suggests a tailored treatment, maybe a custom drug or a combo. Your counselor explains how your genes affect your test risks and walks you through the plan, making you feel doable. Globally, resistance rates drop because AI is guiding smarter drug use and counselors are empowering patients. It's a world where superbugs don't win.
That world sounds amazing. Dr. Khurana, thank you for breaking this down and showing us how AI and counseling are teaming up to tackle superbugs. To our listeners, I hope you are as inspired as I am by this fight for our health. If you're loving this series, hit subscribe. We have got more coming on gut health, real time diagnostics, and ethics. Next up, we'll explore how AI unravels the gut brain axis with counseling to support mental health. Don't miss it. I am Sakshi, and this has been Genes, Microbes, and AI, revolutionizing infection control and counseling. Stay curious and take care.